Hives versus rash in your child. Figuring out if your baby has hives or a rash can be tough. Before we talk about what the differences are, let's first talk about hives. Hi, I'm Dr. Mansi Kotwal, board-certified pediatrician and medical advisor with FemHealth, and we are going to talk today about hives and other rashes. Hives, also known as urticaria, are raised, itchy bumps that appear on the skin and usually disappear actually relatively quickly, usually within hours, but sometimes can take up to 24 hours to completely resolve. While most people think of an allergic reaction to a food or medication when they see hives, there are actually several common causes, and in many cases, the cause of hives is unknown. Other causes of hives include infections, such as viral or bacterial infections, insect bites, exercise, extreme temperatures, both hot and cold, pressure applied to the skin, contact with certain pets, and the list goes on. In general, hives are not dangerous, but should be evaluated further if there is concern for an allergy or an infection, if they've been coming and going for several months, are lasting for longer than 24 hours at a time, or if there is concern for other symptoms, such as trouble breathing, abdominal pain, lip or tongue swelling, fevers, weight loss, joint pain. If there are any concerns about the cause of the hives for your child, always discuss with your pediatrician. In general, a dose of an oral antihistamine such as Benadryl or Zyrtec can be helpful to relieve the itch and help the hives fade away. It is often hard to tell if a rash is actually hives or another type of rash. There are many causes of different types of rashes as well. These include infections again, irritation, for example from a detergent or soap, dyes or other chemicals, poison ivy or certain plants, eczema, psoriasis, medications, and again, the list goes on. Hives have quite a distinct appearance. They're usually discrete, but sometimes can coalesce together and look larger. There are red areas that are flat, and then there's raised areas in the center, and the key feature is that they're really itchy. The more you itch, the more raised and red it will get, and sometimes even cause bleeding due to breakage in the skin from the nails. If you lightly push on the redness, it will actually go away or appear white in color or at least closer to the skin color and quickly come back once you stop applying the pressure. There are many different types of rashes and they all vary in terms of what they look like. Often, rashes that are caused by viral infections are confused with hives. While some viral rashes can be slightly itchy, they're often not as itchy as hives and they're often finer bumps as opposed to the larger raised areas seen with hives. With that said, it is really hard to distinguish for families, and in this day and age, when we have smartphones accessible, families often come in with a picture of the rash, which is very helpful when trying to determine the cause or the type of rash. So I would encourage you to take a photo if possible and bring it to your pediatrician. As always, I hope you found this helpful and interesting. Thank you for watching, and be sure to like and subscribe below. The doctors at FemHealth are here for you and your family.